Good morning, ladies and gentlemen. Welcome to Lifestyle with Dr. Moby. And today we are honored with great guest, Dr. Erin Ellis from Arizona. Let's welcome her. How are you doing?
I'm good. Thank you so much for having me.
And doctor is actually a naturopathic physician, and let's learn from her how it got started and what is naturopathic physician, first of all.
Yeah, so this is actually really my second career. I graduated from high school and went to University of Arizona, which is in Southern Arizona, pre-med. I wanted to be a trauma room surgeon. However, I realized there's a lot more schooling that I was going to have to do and kind of gave up on those dreams because I was just didn't really want to be in school that long. Transferred to ASU, Arizona State University, in Tempe, Arizona, and got my degree in business, and then worked in bars and restaurants for many years in restaurant management. And always knew that I wanted to do something more and be something more, but I couldn't ever figure, I didn't know what that was. And in 2010, I was diagnosed with a rare form of non-Hodgkin's lymphoma. I had a tumor by my bladder, and it was very rare, accounted for only 2% of all non-Hodgkin's lymphomas, and typically found in older men. So why it was in me at age 31, I have no idea. But honestly, it was like the pivotal moment in my life. During that journey, I learned a lot about health and wellness, lifestyle, diet, everything that I was really naive to. I didn't know any of these things. And shortly after I kicked cancer's butt, which actually on Thursday will be my 11-year anniversary of being diagnosed, I met a naturopathic doctor. And I really didn't want her to stop talking about everything that she did as a physician. And I knew nothing about naturopathic medicine. It was like, what? A naturopathic doctor? There's such a thing. And come to find out, there was a school in Tempe, Arizona, which was about 15 minutes from where I lived at the time. And I was like, this is a sign that I need to do this, because everything is just aligning like right, in a row. Like, okay, this is, something you're supposed to do. It's the knock on the door. And I went to the school to find out what it would take for me to get in, because remember, I went to U of A and I had a few science classes under my belt from being pre-med there. And I really only needed 2 classes to get into the school with all of my prereqs that I had already done at U of A. So I was like, all right, here's another sign. So sure enough, I did those 2 classes and got into the naturopathic medical school and started in 2013 and graduated 4 short years later in 2017. And I've been practicing since. I started out in a naturopathic urgent care in North Scottsdale, which is about 45 minutes from where I'm at now. And then towards the end of 2019, I decided to come to Southeast Arizona, or I guess Phoenix or Gilbert, East Valley, Arizona, and open my own practice. So in January of 2020, not knowing that we were going to be facing this pandemic, I opened my own practice, and here we are.
Very nice, very nice. So tell me, for audience, as to understand, what is difference between a naturopathic physician and other physicians?
Yeah, so I get this question a lot. Naturopathic doctors are trained similarly to medical doctors. We have a 4-year medical degree program, very similar. The first 2 years is all basic science, so anatomy, physiology, biochemistry, all of those things. And then we take our first set of board exams on those basic sciences. And then the second 2 years of our schooling is all didactic work and clinic work. So by didactic, I mean, say we take a class in cardiology. So we learn how a medical doctor will treat high blood pressure. And then we learn as a naturopath how we can use lifestyle, diet, supplementation, and giving the body what it needs to heal, rather than giving a prescription medication. Now, there's a time and place for pharmaceuticals. However, a lot of disease processes can be prevented or cured if we give the body what it needs. And that's the beauty of naturopathic medicine. We also abide by 6 different principles. And the first is choose the least toxic and least invasive therapy, which oftentimes isn't a pharmaceutical drug. We also look at the whole picture. This is probably my favorite part of naturopathic medicine, is we look at the whole body. So if you were to come to see me for, say, a headache, like, I'm not just going to address the headache. I'm going to look at your body as a whole, because it's all connected. I do a lot of treatment or therapy for women and hormones, adrenal, thyroid, but all of that is all connected. So I can't just look at, your female hormones for your periods. Like I have to look at your adrenals and I have to look at your thyroid because it's all connected. So that's one of the big things that we do is look at the body as a whole. Prevention is huge because a lot of disease processes can be prevented. So we focus a lot on that by doing comprehensive lab work and spending upwards of 60 minutes with patients. So I have 4 new patient appointments today, and I'll spend 60 minutes face-to-face with each patient going over their entire health history and really getting to know them as a whole so that I can best give them the best healthcare. Another principle is docere, which means to teach. And that's another one of my favorite modalities because we actually teach our patients what we're doing, why we're running certain labs, what the lab level means, and where they fit in that little range of normal, and if that's really optimal or how they can actually improve this, or if they're on the low end of normal or high end of normal, etc. So that's kind of how we differ as far as treatment goes. We think outside the box. I'm very nosy, so I draw a ton of lab work. But it's really important to really understand your entire health picture by looking at the body as a whole.
They're very nice, very nice. Of course, I practice conventional medicine, but I'm also a big believer of, lifestyle. I myself, lost 100 pounds and then 4 years natural way, no medication at all.
Awesome.
Just your modification of your normal style, what you eat and what you exercise and sleep. So those principles. So and didn't spend money, no surgery, nothing, and then continue with that 4 years plus now. So and same lifestyle. So it became diabetic and so forth, but now all gone. Diabetes
Awesome.
gone, hypertension, nothing, no problem. So since that day, now I'm also a big believer of lifestyle changing your, and I realize what you are saying exactly is that the conventional medicine basically they focus on giving just medications, and medication. And then with this lifestyle, actually, you can cure a lot of disease. With conventional medicine, you can't. And then, and the sad thing is that all the medicine is geared towards that right now. So giving medications and medication, and then not fixing, which could be done naturally, right? So this is very, very nice that you're already on that and you're practicing what it's interesting. I've practiced 20 plus years in conventional medicine, and now I realize that why in the world we were doing that route, not lifestyle or changing natural way, right? So there is definitely, there's definitely a big evidence, and I don't know, the literature somehow does not highlight those very much. I don't understand that, do you know?
Yeah, I mean, that's another. So we have tons of training, tons and tons of hours of training in nutrition, and a lot of medical doctors, unless they've done some type of integrative medicine or supplemental training as far as nutrition goes, like that's a huge component of my practice is teaching people how to make healthy habits and diet and lifestyle and things like that we just take for granted, or maybe we just don't know. And I think that's a lot of where I was, 12 years ago before my cancer diagnosis. I didn't know any of these things. I didn't know that it was important to really exercise and to eat vegetables and to limit sugar and all of these things that, now it feel like common sense to me, but it's not common sense to the majority of people out there.
Yes, and same for me too. I was not a big believer at all. I used to make fun of that. No, that is not for us. But now I am actually reversed. So that is true. And, but it is, I think the other thing is the pharmaceutical industry as well as food industry. They
Mm-hmm.
are to blame, for a lot of this. They will just push people to do this, and then advertise heavily. Uh,
Mm-hmm.
and then we have this kind of problem where each industry gains from each other. Pharmaceutical gains from food industry as well as,
Mm-hmm.
because they don't want you to get better. For
Yep.
I okay. So let's talk a little bit about these principles for educational purposes. Of course, what are the key components you would like, or get some tips for any
What do you mean?
key component for the diet?
The key what? Components of the diet?
Yeah.
Oh, okay. Well, I primarily work a lot with women. So, a big thing that I teach all of my women to do is to look at their plate and make sure that they're getting protein, fat, and fiber with each meal. And if they're doing that, then they have a well balanced diet. I am not a fan of diets. I don't think that there really should be any sort of diet, because I've seen a lot of failure with diets. Or what happens if you finish this diet, then what? Are you just going to go back to your old eating habits of, the standard American diet, going, to fast food or quick and easy, and not having this diet that you were on? So I'm a huge fan of just teaching people how to eat healthy and make healthier habits, so that it's more of a lifestyle and not, okay, I'm going to diet for 3 months and then what? So teaching, the protein, fat, and fiber at each meal. Also, just being more mindful of how much carbs they're having, how much sugar they're having in proportion to how much good fat and protein that they're getting. And I sometimes, if women don't have any idea where they're starting from, I'll have them track their foods for a few days just to see. And it's actually really eye opening. And it's a good learning experience for themselves, because they're like, oh my gosh, I had no idea I was eating so little protein, or I was eating so much carbohydrates, etc. Especially for those people that have blood sugar problems, or, pre-diabetic, or have a lot of inflammation in their body, which can set them all, more susceptible to having some of these diseases. So that's typically where I start, is just being mindful of what you're eating. We're just so quick to go grab food and eat it because it tastes good, or because it's convenient, or it's in the fridge, or whatever the case may be. But have we actually really sat there and said, okay, I've got this, this, and this on my plate, or oh no, I'm missing, or I haven't eaten any fiber today, or I haven't eaten any healthy fats today. So just being more mindful of what you're eating is usually where I start.
Okay, very nice. Yeah, actually, in my book, I have also a chapter. It's called Mindful Eating, and
Yeah.
a lot of people don't realize, but actually, if you put mind to eating, it really helps. Especially, if you eat slowly, take
Mm-hmm.
your time,
Chew
and
your food.
yeah, and then you want to, taste the food, because
Mm-hmm.
many times if you eat very fast, you don't know what you ate pretty much. So you know
Mm-mm.
it, and it's been my personal experience too that you tend to eat more. So
Yep.
and the fast food industry is geared towards that. You give your order, and somehow people think that you have to finish in 5 minutes and get back to work,
Mm-hmm.
and there is a big problem, right?
Mm-hmm.
So then the mind, and of course water. I said drink water before you eat, and so on. It kind of and you don't have to eat all at once, because the body, especially stomach, is just a bag. So more you fill it, the more you stretch it, the bigger it gets. So,
Mm-hmm.
but if you don't stretch it too much, means eat less at a time, then it's very natural that it's going to remain small. And,
Yeah.
and there's a big problem because you know for many reasons, if you give body a lot of things to do at once, it's like not very smooth operation for body, because there's a limited amount of blood. It has to
Mm-hmm.
dedicate all the blood towards
Mm-hmm.
GI versus towards your brain and vital organs. I mean,
Mm-hmm.
there's a little difference, and then it's common sense. But this is mindful eating. This is
Mm-hmm.
exactly what we want. We want
Yeah.
take your time, enjoy, and then do not eat at once.
Yeah.
Those are very, very important. Simple. It looks very simple. Actually, it's very, very powerful. You know.
Yeah, absolutely.
So those when a lot of people come and ask me, and they say, "Oh no," and the other important point is about diet. So none of these diet actually work. That's perfectly fine, because I think when I also started, I looked at, being a physician. We said, oh, over the years, I said, well, what should I do? Because I knew I was going in wrong track. I said, one thing is I should just go in and get, at some kind of a camp, and then lose all the weight. And then, but then exactly your point, what happens when you come back? So how you going to make day-to-day changes? And then
Hmm.
so that, for the same reason, surgery never works very well,
Hmm.
because you can get surgery very good, but what happens after that?
Hmm. Hmm. Yeah.
So, so 2 years, a lot of few years later, even 6 months, there's many people to, they go back to, unfortunately, their bad habits, and then surgery fails.
Hmm.
Say, well, problem was never here, and not in your stomach. Problem was up here.
Hmm.
Should maybe have some kind of surgery there, or
Yeah.
some change in our thought process.
Hmm.
That's all we need. So, and a lot of people say, oh, can I will be eating this much after surgery and this much. I said, why don't you try that before surgery, and then see if that works, right?
Hmm. Hmm.
Because you'll be living that life after surgery, and then why don't you try
Yeah.
for that? So, and then, oh yeah, that's but where I find also is convincing people, how to make those changes. And first of all, they don't believe that's that easy. But second is, they somehow don't understand that it can be done, right? It can be done. So where do you see this problem going, helping them to understand and making us change, like yourself and
Yeah.
believing in lifestyle?
My favorite thing, and I think that what's most successful, is picking one thing, like one bad habit, and disrupting it. So if you're prone to going to get, say, a soda at 2 p.m. because that's just what you do, like, change that. Go to the fridge and grab like water instead, like cut out that soda. So pick one bad habit at a time and disrupt it. Because if you just go cold turkey, for some people that don't know what in the heck to do or where to start, they're going to set themselves up for failure again, because if they go back to their old ways or add something in that they, shouldn't have, then they're going to feel shame, remorse, guilt about it. And then they're just going to be like, oh man, I just totally reversed everything that I've been working hard for. And then they give up, and then they just go back to their old ways. So, it's simple as just making one little change, or instead of having, a whole potato on your plate, just have half a potato and have more vegetables. I'm not telling you to like cut things out of your diet. Just be more mindful of it and maybe replace some of that food with something healthier. You can still have the foods that you're used to. It's just making sure that it's balanced. And I think that is really successful and really helpful for people to understand. It's like, okay, well, go have the cookie if you want to have the cookie, because tomorrow you probably won't have a cookie and you're going to eat, really healthy and clean, but you also allow yourself to have that little reward or that little treat, because it's okay. It's not the end of the world. It's not going to set you backwards. It's not going to negate everything that you've done for the previous few days. So that's typically how I like to approach it. And I feel like that's a really successful way at doing it.
And that is so true. Baby steps, one step
Yeah.
at a time, and then, and one thing which I have seen in my case was, success is, like that. So any success in one step would actually reinforce 10 other steps.
Yeah.
You can do that if you are failing first one. So that is such an important concept. Yes, I will now keep that in mind, and that's actually a great approach.
Mhm.
Also, since you have great work experience in women health, so tell me also, I always find this very interesting. There's a big difference how women eat and men eat. So, so tell me a little bit, how can we help them?
Well, that's the big thing about these diets. And all of these diets have been studied on men and they haven't been studied on women. And women, unfortunately, are not tiny men. Like we are completely different. Our chemistry is different. Our hormones are way different. Men have really two hormones that drive them, cortisol and testosterone, and women have a million other hormones and working for us and against us at times. So yeah, that's why the protein, fat, and fiber for women is so important, because not only is it helpful for their blood sugar, it's helpful at reducing inflammation, it's helping get them good calories so that they can make hormone, because that's another misconception, is that higher cholesterol or low cholesterol is like the goal. Well, we actually need cholesterol for our hormones, and it's a huge building block of our hormones. So if we don't have the good healthy fats, or have way too high of cholesterol, way too low of cholesterol, like that's actually not helping our situation. So yeah, it's tough. And also for women, like we think the less that we eat, the more that we're going to lose, and that's another huge myth. It's a lot of times women are struggling with weight loss because they're not eating enough, and I have to like switch their brain and explain to them why. I'm like, you're not eating enough based on your metabolic demands. Like women that are constantly working out once or twice a day even, I'm like, and they're not losing weight. I'm like, well, I don't think you're eating enough. And they're like, there's no way. Like, what do you mean? I need to eat more? And it's like, yes, we have to work with your metabolism, but then we also have to make sure your mitochondrial function is good, because if your mitochondrial function isn't good, you're not going to have good metabolism. So there's a whole, it's like women are complex. And I think every man will agree with that in more ways than others. But as far as like weight loss and hormones and all of that goes, like it's a puzzle, and men can literally cut out cheese from their diet and lose 10 pounds. And it's not that easy for women. So we struggle and it's hard. And that's why teaching you the healthy habits, so that way you don't have this yo-yo dieting effect of up and down with your weight. You can maintain your weight loss, steadily, and not have to worry about doing any diet.
Mhm. And the other thing is very fascinating. I always tell a lot of my clients too, that there's a big difference between women and men body. Men, in my opinion, should be more leaner. Okay,
Mm-hmm.
because we don't need as much fat, because we need testosterone and muscles. Yes,
Mm-hmm.
we don't need fat, but it is kind of very interesting that social stigma somehow stigmatize women and not men. So
Mm-hmm.
so men could be very obese and have big belly and all that, and they say, oh, they look great. Or no, they look horrible, because uh, for many reasons there's a ratio between testosterone and estrogen switches once you have that kind of visceral fat a lot, and you need testosterone, you don't need estrogen and so forth.
Mm-hmm.
So those but they somehow kind of hold women more on that, and then not men, and I don't understand why we have that.
Mm-hmm. Mm-hmm.
So that's so true. Women can have some degree of they need actually for hormones. They need more of these cholesterol molecules and some of good fat, which men might not need as much.
Yeah, absolutely.
And that is so true, and that's so true. So where you think we can, as you know, we have three big industries against us: pharmaceutical, food industry, and also a lot of education has to be done to people.
Mm-hmm.
Where we can do better, where we can, you think we can help a lot of people.
Honestly, what we're doing now is more things like this, like integrative medicine. Medical doctors working with naturopathic doctors, or even not. I mean, that would be awesome too. But having patients have a medical doctor on their team and have a naturopathic doctor on their team, so they get both benefits of, Western medicine and naturopathic medicine, so that they can become their healthiest versions and learn these things that, people don't know. And that's why I love doing what I do. And I love doing podcasts like this and education around it, because it's so important. And I was in that, same thing 12 years ago, and I knew nothing about any of this. I just, ate to eat. And there's a lot more to health and wellness than what we think. And that's why it's important to have, someone like a naturopathic doctor on your team, or educating yourself more by reading books or podcasts or whatever the case may be for you.
Okay, very nice. And one more question is about cancer and the rise of carcinogens. And so tell us a little bit, any tips you would like to share about some of general principles on that.
Yeah, as far as diet goes, like when I was first diagnosed, I read a book by Chris Carr. It was like Crazy Sexy Cancer Tips, and she's a very well-known advocate in the cancer community, and she's got a dormant cancer that's always with her. But when I was reading her book, I'm like, what? Like, this is fascinating. I had no idea. So the first thing is, cancer is driven or fed by sugar, and sugar is so predominant in our diet. And if you wanted to start anywhere, it's just being more mindful of how much sugar you're actually eating. And sugar, can come from fruit, and it can come from carbohydrates. And that's it's not just eating a brownie. Like, you get sugar from other things in your diet. And that was something else that I was naive to. I didn't know that. I didn't know, like, oh, a banana has, so many grams of sugar in it. I thought bananas were good for me. Well, they are good for you in moderation. So things like that. Water and hydration is huge. I hated water. I never drank water because it was boring. It just doesn't taste like anything. And I didn't know that you actually really needed to drink water, because it's so important for your immune system. It's important for your brain health. It's important for your lymphatic system, which helps you detox, all of these things. So yeah, those are like two big tips: is sugar, trying to avoid sugar as much as possible. And even like the artificial sugars, like those are even worse. And I would be very leery of anything labeled sugar-free. Make sure you read your labels, because if it says sugar-free, it's going to have some probable fake sugar in it that's even worse than actual table sugar. So yeah, be your own advocate, do your own research, read your labels. And when you don't know, look it up or ask someone that knows. So.
Hmm. And the other thing is, I always find it very fascinating. A lot of products out there in the name of detox, they are very bad. So a lot of my patients said, "Oh, I'm having a detox week or whatever. What are you eating? What are you doing?" Oh, this kind of whole, in my opinion, those are wrong food. And I say, well, detox for body will be like giving water. That's the best detox, by the way. And then, maybe some kind of fasting where you don't eat as much. Okay. So give system break. That is called detox for human body, not put too many chemicals, and which they don't. Not at all. But so give a break, and then that, in my opinion, water is the best detox anyone can have.
Absolutely.
So yes. Any final thoughts, and would you like to share before we end the program?
I just want to say, just be your own advocate. With my whole health diagnosis, like, I knew something was wrong, and I was not necessarily brushed off, but I just wasn't getting any answers. So if you have any health concerns, whether that's like, I'm tired all the time, or your hair's falling out, or you can't lose weight, or your hormones are a mess, and you're being brushed off like you're normal, like, go find functional medicine doctor or naturopathic doctor if you don't have one of them on your team, to really help you get to the root cause, because life's too short to feel suboptimal, and we should all be living our healthiest, vibrant lives.
Okay, great. Thank you for coming to our show, and check out her website, Doctor, your website, if you want to tell our audience about your
Yeah,
website.
my website's drerinellis.com. You can find all my social media links there. I'm very active on Instagram and Facebook, so you can find those links there.
Okay, very nice. And thank you for educating us, and good luck. And maybe, hopefully, we'll see you some other day. Take care. Thank you.
Thank you, Dr. Moby.
Take care. Bye.